matter where you are, help and support is just a phone call away. Dial 1097 HIV/AIDS National Helpline toll-free.
Na marka jingkiu biang uknyang jingpang COVID-19 hakiwei ki Jylla ka Sorkar Jylla kala shimkhia ban pentikna baya ka jakarung shaka Jylla dan kam ban bu rinti aki kendon kumbala le haus nembala deb ban lat na ka jingyo COVID thamai. U Commissioner Secretary katanat ka kot ka kya u Sampat Kumar ulaong babaro ki padba ki bawan phai sha Jylla ki don kam ban pinrum kerteng pat ban sha tes yaladi kat kum ka jingpatha jong katanat ka kot ka kya ka Jylla namar ka jingjur ka jingpang thamai na ki wei ki Jylla ka ri India hakabala batha badon kam badle ya ka RT PCR ulaong ba ka Sorkar kam shimla shong klikti bat kan sedang penmi biang ya ka jingpen bana ni ki kendon hak ni ki ski panwan lada ka jur ka ni ka jingpang bat ula kenturu ya ki padba ka Jylla bakin long ki ba phikir ban yada yaladi.
As on date, the active cases in the state are 108. Out of them, a lot of them also have come from the cases, from the returnees, who are coming from outside the state. So that is the reason the state government has also actually stepped up its entry protocol, and now we are actually asking for RT-PCR negative reports for those who are coming to the state. So especially those 11 states that where there are a large number of cases have been reported. So for those 11 states, we have been actually asking them to come with the RT-PCR negative report, and also we wanted to extend this to other states too. That notification also will come soon. So besides that, actually, generally, if you look at there is a increased number of cases. It's like a second wave across the country. In many states, the cases are rising, and this also has been a cause of concern. And we need to actually, inform the public that there is a need for taking more caution and care towards the COVID protocols. So we need to really adhere to these mask protocol all the time, and make sure that we maintain that social distance, and also whenever we have any symptoms, we should basically test ourselves whether there is any COVID or not, and also quarantine themselves. So this is one very important thing, is that behavior change, and especially taking that responsibility. Everyone has to take that one's own responsibility, and to see that they might cause problem to others. That is the first thing that we should do. Instead of thinking that others would cause problem to me, I might cause problem to others. So if I actually wear a mask and if I take proper care, I would not actually cause problems to others. So I think that kind of inside out, the locus of control requires to be brought in among the citizens. So we have issued the behavior change management protocol last year. So we are going to reiterate that one, and we're also asking the districts to activate this behavior change management committees. We have community COVID management committees and also behavior change management committees involving the traditional headmen and involving the frontline workers and the teachers and everyone. So the idea is that collectively we have to really work and stop the spread of this virus. And we also have seen that reports that the second wave, the disease is more infectious, means it's transmitting faster. So seeing those reports, we should take more care. So that's one. And number two, of course, we also actually like to emphasize the increased vaccination, especially for all those susceptible category of citizens. The susceptible category of citizens are those who are above 45 years. It's allowed now. So in fact we have requested all the districts to proactively vaccinate people. so that we can really ensure safety to them, because they are more vulnerable than other sections. So we need to in fact we have the capacity to vaccinate a large number every day. So we wanted to achieve that full potential of that capacity that what we have. And a lot of focus I think we also wanted to give in the urban pockets, because this is the place where large number of cases have been reported in the past and also even now. So there is a lot of focus is required in Shillong, Tura and other urban localities. So these are the two approaches that what we are talking about. Is that one is that the behavior change, or we call in fact Government of India says it's a COVID appropriate behavior. How actually each one of us take the responsibility. So that's so important, and that need not be told by somebody, and each individual with that consensuous mind should really respond to the situation. And if they have to care for their family members, they have to care for fellow citizens. So that is a very important. Second is that we also require to emphasize and focus on the coverage of the immunization, especially we have got vaccines, we have got good capability, and our teams have been doing very good work in terms of the vaccination. So the citizens should come forward. In fact, we also wanted to tell the behavior change management committees and community COVID management committees to proactively mobilize all the people who need to be vaccinated